Hello, everybody. My name is Kiara Makaraig. I'm a fourth-year medical student, at Michigan State University, and I'm here today joined by two lovely pediatric PM&R doctors, and we're here to talk about cerebral palsy because March is Cerebral Palsy Awareness Month. And hopefully this is coming out to you all on March 24th, which is Cerebral Palsy Awareness Day. And like I mentioned earlier, I'm joined by two amazing pediatric PM&R doctors who specialize in cerebral palsy and treating kids with CP. I'm joined here today with Dr. Dy. She is Associate Professor and Vice Chair for Education, also PM&R Residency Program Director at Baylor College of Medicine in Houston. And I'm also here with Dr. Domingo. She is double board certified in pediatrics and PM&R, and also an assistant professor of pediatrics at Cooper Medical School at Rowan University. So hello to both of you.
Hi everyone. Thanks so much for inviting me.
Yeah.
Likewise, so happy to be here.
And thank you for joining me here today. So with March being Cerebral Palsy Awareness Month, I guess kind of the first question to knock out of the park is what exactly is cerebral palsy, and how does that relate to the work that you're doing within pediatric physiatry?
Cerebral palsy is a term used for some developmental delay. You know, sometimes it could be from birth. That's the misconception that can happen. Sometimes it could be acquired or trauma related. It is a big part of our practice in caring for these kids that have a lot of specialty needs, and especially if the injury or the accident or the birth injury is, from birth, they need to be closely followed throughout their lifetime to make sure that they develop to their full potential in their function, psychological, emotional well-being.
Yeah, and to piggyback on that, I mean, we know that the cerebral palsy is actually the most common disability in children. And there's a lot of misconceptions as well, or even they give diagnosis here and there, but it is the main thing is really the reason why we're also wanting to raise awareness is because it's often this either undiagnosed or misdiagnosed or very late in the game. Early intervention is key, as well as Dr. Domingo was saying. Once you've diagnosed and provided that opportunity for the family to know what are the needs of the child, then you would be able to also intervene earlier. So early intervention is key. So if I may expound a little bit, as you were asking, what is
cerebral palsy?
Based on the definition of cerebral palsy, it's a group of conditions basically that mainly states that it is a static, meaning it's a non-progressive injury or disease process, basically, that it's due to a one-time injury, or sometimes even a developmental it's a maldevelopment of the brain because it's not like something that would progress. It's a one-time injury. It's a static injury to the brain in an immature brain, and would have motor problems, and then also all the other associated problems with it, then depending on the degree and the location of the brain injury or the brain maldevelopment, so to speak. So you could say, you have a cerebral palsy, but what is the cause of cerebral palsy? Causes of cerebral palsy could be varied.
I see. So Dr. Dy, you did mention that early intervention is key. So catching it early, intervening early. What exactly does early intervention look like? Like, what sorts of things are you, how does therapy look like when you catch it early? Just long story short, what is early intervention, and how does that look like for the child and their family?
Early intervention is basically providing the necessary, first of all, it's the education, right? You need to let them know that, yes, this is a delay in development with the motor function, and also providing both, either in therapy services or even vision therapy, physical therapy, occupational therapy. If we're looking into the motor development, also it entails vision. And at the same time, understanding as well, how would you be able to try to facilitate, the development of a child towards trying to achieve as much as the milestones that they are able to, or also prevent some of the possible complication, mainly like musculoskeletal complications such as joint contractures and all the other deformities as they're growing.
Especially with our high NICU follow-up, that's a big part where we can early identify these kids with cerebral palsy. There's been a study out of Pediatrics journal in May, I think 2020, that showed some evidence-based guidelines on early detection. I think they lowered the identification, I think, from 19 and a half months down to 9.5 months of age. With the guidelines, I think it's using the Hines score and the GMA score, which is the gross motor assessment, the Hines testing, where they are able to identify these kids early on and then provide the early intervention, as Dr. Dy was mentioning about the support services that, depending on the state that they live in, are allowed to get. Usually it's home-based therapies, whether it be physical, occupational, or speech therapy, as well as an adjunct with outpatient services the child can receive. Also, if they've had visual impairment due to retinopathy of prematurity from their cerebral palsy or premature birth, they're also eligible for vision and hearing support services. And again, depending on the state, there's usually like a commission for the blind, school for the deaf, that they can actually come to the home, which is very paramount in trying to get these kids up to speed so they're not delayed as their counterparts may if they've been identified, say, at 2 or 3 years of age, and we've missed that window where their brain growth is occurring very fast. So that's really paramount, and again, with the early intervention and identifying these kids early on so they'd be closely followed up, and then really prevent a lot of the complications if cerebral palsy is not identified early, as Dr. Dy mentioned, the contractures, the GI issues, feeding issues, reflux, aspiration risk, pain, and lack of function, and really to empower the parents on all these support services, because it's not a usual general pediatrician practice, as you can imagine, because it's general ped, you're using, well child visits, ear infection. And when you have a child with a special needs, it takes a lot more time for the pediatrician to go through all of these line items, where a pediatric physiatrist is well versed with all of those pieces and putting it all together. An ideal place, and I'm sure maybe more so at Dr. Dy's center, where in an academic setting, you can have physiatrists, you can have your psychologist, you can have OT, PT, and speech, case managers, and social work there as an arena evaluation for these kids that need all those services, and then being able to help navigate in the community, because that's the bigger part.
It sounds like peds physiatrists are really like the backbone for like children with CP. They're able to coordinate amongst other healthcare professionals, and it seems like you have them all in your back pocket. You need an ophthalmologist? I know a guy. Or you need therapy? I'm going to send you here. And we're coming here today. We're talking about CP, but also we're representing, PAPA, so Filipino American Physiatry Association. And within the Filipino American community, of course, family is number one. Family is so important. And I can only imagine that, a Filipino family or child going through this diagnosis, the parents just want to know that their child is well taken care of. And the fact that pediatric physiatrists are so kind of plugged into that healthcare community, they really have the professionals backing them up, or they have other people to go to, the therapists to go to make sure that their child receives that comprehensive care. Hopefully any Phil-Am families out there, they'll feel more reassured knowing that their pediatric team and their doctor really has their back and has the interests of their child as, their number one priority.
Right, you're right. Sometimes they actually refer to us as their pediatrician.
Yes. And they're always like, that's very true.
Yeah, almost like they're PCP in a way that they, because I get these as well. It's like, okay, like to ask Dr. D, like, are we okay to go to school, all that stuff. So, but yeah, I think the one thing too is having that. I just wanted to add as well, aside from the empowerment, it's also getting the resources, having the diagnosis, because that is one of the diagnoses that are recognized, by state funding or your insurance and all that. So even though sometimes the rest of the other stuff, for example, the prematurity, all the other things that they have, but having that specific name, that the diagnosis itself, that kind of brings it all together, having that diagnosis helps them to be able to access some of the resources, both in the community and also from a healthcare standpoint. And as Dr. Domingo says, it does vary by state, and also by insurance coverage, but from a medical care, as well as even like also understanding that and joining like family support groups, so that they're understanding as well. It's tough to navigate, outside, even just you have that medical piece, but even to navigate through your community, it's not easy as well. That's something that, as I said, not just having that diagnosis, but knowing what resources, how they would be able to advocate for their child in school, for whatever they need, if it's accommodations or getting special education, just so that they could be included as well in the community.
Yeah, and again, as they get into the school and knowing that they have preschool handicap or special needs in your state is really important, so that they can get into the school system early, and then hopefully transition, hopefully in a regular school, mainstreaming with an individualized education program catered to that child. And then they would be able to get all the support services with the least restrictive environment, so that they're as normal as you want to, as they can be, to foster their development, both emotionally, psychologically, and physically. And again, ultimately to be independent. As you know, as Filipinos, we want the best for our child. We want them to strive for the best, so that they can go to college, even if they're wheelchair level, or walking with lost strands or walker, all those adaptive things, and support services that they are even entitled in secondary education. So hopefully that carries through as they, their development. So that is the challenge, I feel. And then the challenging part is when they transition to adulthood. That big piece with a lot of our cerebral palsy patients and teens, when they transition to young adulthood. Who is the adult physiatrist that's going to take care of this? Who is their adult PM, TCP going to manage? Because there's not many of them. And I will say here, there's a very, we know some, but then it's a lot for them to take on, because it's not their usual bread and butter caseload that they usually see in the adult, as we do in pediatrics and pediatric physiatry.
So I'm definitely starting to see a pattern here. So it looks like early diagnosis is very key to get that early intervention, get all the therapies in, so that they can live hopefully a full life as they age and as they get older. And no doubt about it, I feel this diagnosis is, it's difficult for parents, for families to hear. And although, yes, there are many resources for their child to go to therapy sessions, see healthcare professionals, X, Y, and Z, how do you address kind of the psychosocial aspects of disability or chronic illness with your patients and their families?
Good question.
Yeah. I think I usually started, because we as pediatric physiatrists, we usually are kind of the bearer of the bad news, so to speak, because it's already there. When they come to us, they've been referred, and maybe they may have heard the term, but nobody has really given it to them. Usually it ends up being in our conversation, and that's where we typically also kind of, as I said, like we try to, usually in our first meeting with the parents, right, we need to give the diagnosis, but we also wanted to, first of all, that's why I start with the definition, because they already know it, they see it all. So I was kind of just packaging it for them. And then, as I said, basically just explain what this is. We're not adding anything to what the child already manifests. We're just putting a package, so to speak, like to say this is what it is. It goes all goes with this one, and so a lot of the times it's also, the depending on the priorities, like their goals. So the walking. So sometimes they so it depends on where the patient or the parents or the caregivers are with regards to receiving that diagnosis and having that discussion. It might be they have heard a lot already, they just wanted to get that closure, or like having that diagnosis. Is this really is, or is it not? And then you may have to do it in small, like subsequent visits to kind of explain further, because it's a lot. So I think that's one of the privileges we have. Over time, we develop that relationship with them. We get to know them a little bit more, what they're open to, what they're ready for, and while we're starting to get to know the child, and then also give recommendations, and also provide some resources at whichever stage they are at, that they're ready for.
Yeah, I agree with Dr. Dy. And when we have to, we are the bearer, I hate to say bad news, when they come to our rehab inpatient, because they're focused usually on the trauma, the diagnosis of their child. They're having an anoxic event at birth, and none of that is like honestly really processing, because they're just, they're thankful that their child is alive and everything else, and now everything's kind of settled. And when they're here, when I first meet them, again, as Dr. Dy said, just stating, this is a diagnosis, this is what happened to your child, whether it be a spinal cord injury or traumatic brain injury. This is the damage or the challenging future now with your child with X, Y, and Z. That I'm pretty transparent, but optimistic and empathetic. So that's a part that I think we do as a physiatrist really well. And in an area, because they're here for a little bit longer, so that we can establish that trust, so that whatever we say is well thought of from a medical, psychological, emotional standpoint to get them to that next level, because they're going through these stages of grief. First, I'm not sure if my son's going to make it. Now they have this, diagnosis of a long-term disability of traumatic brain injury, spinal cord cerebral palsy, and they're in denial, or something like, it's my fault that I did this, or, I wasn't there when he was doing X, Y, and Z. That stage of denial. And then the next part of getting that acceptance. Now we have to learn how to help Johnny bathe a different way, or now we have to do cathing or a bowel program, or feed him a different way. And getting them through those stages, again, to empower them so that they are giving the best to their child before this injury, and knowing that they're giving the tools so that they can make their child successful as they get older and go through their, the developmental stages. And hopefully, depending on the child, being independent as best as they can. Of course, every case is going to be different. But I feel, with our specialty, that's where we shine, in addition to the medical piece, in dealing with some pretty, grim diagnosis sometimes, or long-term disability.
So it sounds like Dr. Domingo and Dr. Dy, in a way, you're both kind of saying, allow your patients to feel all those emotions that they need to feel, go through the stages of grief if they have to, but after that, empower them by educating them, and how powerful a tool education can be. And that's wonderful, and that's the work that you guys are doing every day. That's great. I also like to know, how can individuals with cerebral palsy, so your patients with CP, how can their families advocate for themselves, for their own support resources as they're out there navigating the world?
think being vocal at all levels, in the medical community, in their and in their social areas. As you know, there's a lot of Facebook groups with those types of things, and then a lot of support help groups I think will help, and then organizations that do inclusivity, and into a higher level, the Paralympics. I mean, those kind of things to really empower, like paraplegic can do X, Y, and wheelchair sports, wheelchair basketball, they can drive. So really advocating, just reaching all those social media outlets that we have at our fingertips. And I'm sure the teen, or the child is going to be very savvy as well, making them vocal, advocating for themselves as they navigate through these through their development, and really having that good support network of good friends, family, friends, teachers. I think those are really big key pieces in advocating.
And the social media outlets are out there. There's so many Instagram pages, so many groups to follow, and on Facebook as well, right?
Yes.
I guess the other thing there too is one thing. There's as you said, there's a lot in social media, and so there's also a lot of information that has mixed signals, or like you have to know like what are the more reliable, accurate, and also like that is more evidence based, and so like from a diagnosis standpoint and treatment and all that. So it can be overwhelming as well. And so there's a lot of, as I said, like it can be, sometimes it could be overwhelming. So I do, as Dr. Domingo is saying, one is advocating in the school, learning what their rights are, first of all. So that's where our social workers help us as well. Like, okay, what are the rights, first of all, from at a state level, or even if a federal level, what they can ask for within school, like what they're entitled to, and then also in the community. I do want to mention the Cerebral Palsy Foundation. I think it's one of the better websites as well, in terms of really very comprehensively tackle from a medical, social, and also other support groups that is at least reviewed extensively by a group of people who are really part of the medical and also the support group of people who are taking care and also have maybe loved ones who have the diagnosis. So just on one hand, going to social media, but going into the right places is also.
Okay, excellent. And then kind of maybe we have time for maybe 2 more questions. Looks like our conversation's about to wrap up, but I know you just gave incredible resources for us to kind of help patients and families advocate for themselves. But for our audience out there who is not too well versed maybe in CP or pediatric P&R in general, how can we continue this conversation within P&R world about cerebral palsy awareness, about advocacy beyond CP Awareness Month? For myself, like fourth-year medical students, or even P&R residents out there, how do we keep this conversation going?
Like educational campaigns, workshops, seminars, I think would be helpful about cerebral palsy, so that the layman or the community know about the causes, the symptoms, treatments, and challenges. I think sharing patient stories, I think really does wonders, because they're sharing from their perspective, what they've been through, what has helped, what is needed. And organizations, I think that's very helpful. I'm trying to think. And as we're doing now, the social media campaign with the CP awareness and through Papa, those types of things, I think we can continue to foster that.
I think, yeah, I agree. And also, I guess, also us in the medical, and also you,
Mhm.
Kira, you're coming up too, as like you guys, like medical students. I think it's also a good time to, like, as you are, as you are kind of getting into your specialties and your profession, it's also good to be involved in some of these advocacy, in both in advocacy or
Mhm.
in services. So, for example, volunteering for some of those cerebral palsy camps or other
Mhm.
camps, to kind of have an idea as well, like how it is, for how can we better serve and better understand our individuals with special needs or individuals with some disability. So the get involved, for example, as well, like
Mhm.
Super Bowl. There's the Easter seals. What are the? I can remember the other name of it because I came here to Houston.
Yeah,
The
that I.
Easter seals. There's other names in other parts of the
Uh-huh.
country, but it's not. It's exclusive for cerebral palsy, but it's basically it does serve the United Way. There you go.
That's it. United Way.
Way.
Yeah.
So some of those like big organizations that really also help serve our the individuals with disabilities, because it's also they are also part of the patient population that we serve, and so yeah, that helps enrich as well. So if you have a better understanding, you can advocate for somebody who have some needs.
Yeah, I think to dovetail with that, I think also as you guys are coming through, residency and medical school, like walks or establishing walks. So like the Cerebral Palsy Walk Awareness Month. So depending on where you're at, there's like 5Ks, run and walk, and that is something that you can start in your community wherever you are, and reaching out to families with cerebral palsy, educators, medical field, and a unified way of getting that awareness out with cerebral palsy, as well as raising, funds and for research, for continued research, or support things that families may need, with equipment, because that, depending on their insurance, can get very expensive, and resources. That can be another way to help those in need with children with disabilities.
Awesome. The key, getting involved, and thank you for sending those links, Dr. D. They're so helpful. I would also like to add, I guess, for any third-year medical students out there, any med students out there, do a rotation, do a pediatric seminar rotation. I had the lovely opportunity to do that, and I felt like every day when I was in the clinic, it was a whole new world, and I'm learning brand new stuff, and you get to see the kiddos and see how much of an impact you're making in their life, and it's really rewarding, and it's great. Do a rotation in it. And then my last question for you all before we conclude, is there anything else that you'd like our listeners to know about pediatric PM&R, about CP, about your work in this field, anything at all before we conclude?
I will say I've loved doing what I've been doing for the past 25 plus years. I've stayed here since residency. And again, as I started this journey, I was, as a medical student, I knew I wanted to do pediatrics, and met a pediatric physiatrist who did a fellowship in pediatrics during my peds rotation during my third year of medical school. And that was like an eye-opening field. I was like, whoa, this is really nice that you can work on getting kids back to where they were, depending on whatever injury they had. And that appealed to me a whole lot. And actually I was the first resident in the combined Temple pediatrics PM&R program back in the day. Unfortunately, it's not there anymore. And Dr. D is part of that.
I was the second to the last.
Coming full circle. So as you can see, we both love what we do. And I did all my rotations, I think my sub-I and my electives, all in pediatric physiatry in all the different places, actually Texas Children's, DuPont, Seizure House. So it definitely solidified, my path of going into the field, which I love.
Yeah, no, I as I said, I met Dr. Domingo when I was a resident, completing my combined program in Philadelphia. And so I was not even aware of, I kind of came into it kind of miraculously, so to speak. I'll tell my story at another time, but I was, I graduated from the Philippines in medical school and came here for residency. So it was really just a miracle that, and I'm very grateful as well, and feel blessed and privileged to be able to serve in this role, as well as to be able to get the training and to serve our this patient population. And there's not very many of us. We need more. There might be some difficulty, kind of maybe if you're finding a rotation and all that, reach out to us. I know sometimes there's some barriers with regards to institutions, but look at that. I mean, out of I think, Connie, we've reached 400 certified pediatric rehab now, but at least 2 are in Papa. Look at that.
Yeah.
That's awesome.
So, but yeah, so it's slowly, but that's why we do definitely want to put it out there, doing a shameless plug. We do need more pediatric physiatrists. And it's fun. Look at us. I mean, we actually end up, we're still in our same institutions, but it's actually being much more recognized now. There's actually a lot of jobs out there that positions. If you're looking from a job perspective, there's actually a lot more because it's being recognized as a need, and we don't have enough of our colleagues coming into pediatrics. The nice thing about pediatrics is also, as you said, you like to work with kids, and also you're still really maintaining that full PM&R practice, like fully the full spectrum. You're not just honed into SCI, TBI, and all that. You actually maintain the full PM&R with experience and practice.
That's so lovely. And can I just say, when I did my own PEDS PM&R rotation, it was during Halloween, and children's hospitals during Halloween time, my goodness, it's the best time of the year.
Yes.
Rivals any other holiday. So yeah, that's my little shameless plug as well. But thank you both, Dr. Dy, Dr. Domingo, for your time, for your expertise, for your wisdom. So grateful for you to make some time to come chat with me here today.
Thank you so much. Very blessed to be able to be part of this illustrious group, and Papa hopefully will recruit more pediatric physiatrists. And best wishes to you, Kiara, as you
thank you
to residency in a few months.
Thank you very much.
Likewise, thank you so much for this opportunity, and it's a nice kind of reunion for me and Dr.
Yes,
well.
definitely. We'll hopefully not for the last time. So
yes.
Thank you.
Yeah, we'll wait for you.
Okay.
You decide.
4 years.
It'll go by fast.
So we'll go ahead and end our conversation for our listeners. So goodbye, Papa listeners. It was nice chatting with you today.